Hello ma'am, I'm Rosales and you've given me the task to demonstrate Roots techniques, specifically the light moving touch and the fast brushing techniques, which are both for tactile stimulation that is dependent on somatosensory cues. First of all, the Roots techniques are most commonly used or seen in the rehabilitation process of patients with neurological disorders like cerebral palsy. So in this case, since the two techniques that were assigned to me are facilitatory in nature, which means that they are both involved in the re-education of the muscle for it to move again or even to contract again, even just a little bit. And it could also be used for stimulation of the sensory fibers in our body for cortical facilitation, thus enhancing the quality of movement the patient is able to do. So with that, this type of treatment is best fitted for patients with hypotonia, which means that they have low postural or muscular tone, poor tone, that kind of patients. And we should also remember that these techniques should not be used for the type of cerebral palsy that has spasticity, since the spastic ones are already firing too much, too fast stimulation for the muscles. So it's not rational to use it on those kinds of cerebral palsy. So for the first technique, the light moving touch, you can have the baby rest the forearm on the table and have it supined. So I'm going to try and stimulate the biceps brachii muscle of the baby. I'm going to stroke it in a upward motion towards the head of the patient for 3 to 5 times, like this. 1, 2, 3, or 1, 2, 3, 4, 5. Then after that, I'm going to wait for 30 seconds and observe for responses. And during this time, you could also have a goal-directed activity for the baby to try and see the ability of the baby to flex the arm. So, baby, place a toy over the hand of the baby and try to see if the baby can grab the toy. Baby. The expected response would be a slight or flexion of the elbow, like this. Ching, ching, ching. It could also be that the arm of the patient should be stabilized before getting the toy and trying to stimulate it, so that we are sure that the biceps brachii muscle is the one doing the action and without the help of other muscles in the arm. So repeat that. 1, 2, 3, or 1, 2, 3, 4, 5. Rest for 30 seconds, then apply the stimulus again. 1, 2, 3, or 1, 2, 3, 4, 5. So for the second one, the fast brushing technique actually has the same application as the first one, the light moving touch. But the only difference is that in the light moving touch, the A size delta fibers are the one receiving the stimulus, but in this case, it is the C fibers. And also, in the light moving touch, only the fingers are used as a stimulus. But in this one, a battery operated brush should be used as a stimulus, since it not only stimulates the muscle but it also helps in improving the sensory function of the patient, meaning that it has a cortical facilitation. So since I don't have a battery operated brush, I'm going to use a brush with thick bristles. So this time I'm going to place the patient's arm on the table and have it pronated, since I'm going to stimulate the extensors. And with the same procedure, I'm going to use a brush. So 1, 2, 3, or you can have it 5 times. 1, 2, 3, 4, 5. Then again, rest for 30 seconds. Stimulate it again for 3 to 5 times. 1, 2, 3. Rest for 30 seconds. And observe for the patient's response to this stimulus that we just applied. Lastly, I am going to show and demonstrate these techniques, the fast brushing technique and the light moving touch technique, to the parents of the baby so that they can also do it at home, maybe once or twice a day, for the consistency of the treatment. That's all. Thank you.